Welcome to this Ability Clinic. I'm Dr. Stephanie, a pain and function specialist. Today I want to talk about one of the most important parts of your body. It helps you stand tall and look regal, it allows your arms and legs to do what they do, and it can also break and cause disabling pain. I'm talking about your back. Back pain sucks. It's one of the most common reasons people stop exercising, take time off of work, or go on disability. And every time someone comes to see me for back pain, I teach them the same things I'm going to teach you today. This is also secretly how I wish I'd been taught functional anatomy in medical school. Since you have your own doctors and I have my own patients, please know that what I'm about to teach you is not personalized medical advice and does not replace conversations you could be having with your doctors, but maybe it can start a conversation with your doctors. So to get started, let me clarify one thing. The phrase break your back doesn't really mean anything specific. The back isn't just one part of the body that snaps in half and then stops working. There are many structures, large and small, that make up what we think of as the back and spine. The major types of body parts that allow us to function are bones and joints, muscles, tendons, and ligaments, organs, and arguably the most important organ system, the nervous system, including the brain, spinal cord, and nerves. The back is made up of all of these parts, and injury or disease to any combination of these parts can cause pain and dysfunction. Let's start with bones. Bones are probably the easiest part of the body to understand. They are the scaffolding that holds up our entire bodies. They're strong but spongy in structure, like a stale cookie. Bones support our body structure, but since they're so hard, they also form protective cages around our most important and more vulnerable squishy bits. For example, the skull protects our brain, and the rib cage protects our heart and lungs. Our spine is protected by a bony tunnel called the spinal column. It's a column because it's made up of blocks of bone called vertebral bodies that are stacked on top of each other along your whole spine, from your neck down to your tailbone. Vertebral bodies interlock with each other at facet joints. Facet joints are small, but just like any other joint in your body, facet joints sustain a lot of force. At a typical joint, two bones sit next to each other with a gelatinous cushion in between. For example, the meniscus in your knee is a cushion, kind of like a gummy bear. The strength of our bones, plus the shock-absorbing power of our gelatinous cushions, work together perfectly to sustain forces across our joints while we're exercising, lounging around at home, or otherwise living our lives. Wedged between each bony vertebral body is an intervertebral disc, which is a type of gelatinous cushion. Discs are great shock absorbers. Throughout our everyday lives, our discs sustain the highest pressures and forces when we're actually sitting and slouched forward, like you may be right now. The base of the spine is the tailbone, or sacrum. Its vertebral bodies are all fused together, so it's really just one large solid piece. The sacrum sits nestled inside the top part of the hip bone, called the ilium, think of it as the rim of a bowl, and where these two bones touch is called the sacroiliac joint, or SI joint for short. It's like a giant facet joint, so just like every other joint in the body, the SI joint experiences a lot of forces, since the whole weight of your torso and upper body is moving on top of it. Bones, joints, and gummy cushions experience wear and tear over time. This physical decline is the natural progression of aging and inherent to being human. It's not a matter of if, but when. That's why if you're lucky to live long enough, you will eventually get arthritis. Muscles are the second easiest type of body part to understand. If you've ever eaten chicken or steak, you are familiar with muscles. Muscles are like bungee cords that shorten or contract and lengthen so we can move our bones and thus our body parts. Tendons attach muscles to bones, and ligaments attach bones to bones. We all know there's an abdominal core in the front. That's the six-pack of abs that are mostly a fantasy. We also have a back core, which is made up of paraspinal muscles, since they run alongside the spine. Some paraspinal muscles are large and thick and make big, powerful movements. Some muscles are smaller or thinner or deeper and contribute to more subtle movements of the neck and trunk. Ligaments run up and down the entire spinal column like long strips of duct tape, contributing to the spine's stability and flexibility. Next up is organs. I keep saying organs. Organs make up a very big category of body parts, so to keep things simple, just know that organs are specialized groups of tissues that all function together for a particular purpose. Your stomach is part of your gastrointestinal system. Your heart is part of your cardiovascular system, etc. The health of your entire body relies on each individual organ system functioning properly. We've actually already discussed a major organ system, the musculoskeletal system, made up of muscles and bones. Now I want to focus on the nervous system because it is the computer that controls your entire body. The nervous system is what allows us to do and feel things. When healthcare workers try to revive someone using CPR, the goal is to help the failing heart and lungs provide oxygen and blood flow to the hub of your existence, the brain. If the brain is the main hub of the nervous system, then the spinal cord is the main highway of this system. The spinal cord runs down the middle of your back in its protective bony tunnel, sending off nerve root branches to your arms, legs, and organs. This nervous system signaling allows your body to walk, talk, write, dance, have sex. Basically, your nervous system allows you to do everything your body is capable of, and it's the most important thing ever. You might be surprised to learn that the spinal cord is only as thick as a Twizzler, and its branching nerve roots are like spaghetti. Each pair of spinal nerve roots, left and right, covers its own slice of the body, contributing to the movements, sensations, and even subconscious things that section of the body experiences, like sweating or swelling. We call the territory of each spinal nerve root a dermatome, and here's a lovely diagram that got ingrained into my brain in Neuroscience 101. This diagram makes a little bit more sense if you imagine a person on all fours. Hopefully you can see how the dermatome lines slice the human body up like a loaf of bread. The cool thing is, most living things that have a spine follow this general layout. All of these structures of the back and spine can break in a number of ways. Bones can fracture or pop out of alignment, discs can herniate out of place or tear, muscles can sprain, tear, or spasm, and ligaments can become loose, floppy, and swollen. Any of these mechanisms of injury can result in pain, limited range of motion, and difficulty with mobility. The cord and nerve roots can be pinched, stretched, or otherwise damaged. This is even more serious since nervous system damage can result in not only pain, but weakness, numbness, and even incontinence. That's when you can't control when you go to the bathroom. These are very fundamental concepts in anatomy, but I use them every day at work. In my next video, I'm going to take you through my process for figuring out what is causing someone's back pain and how I make a diagnosis. The first clue is knowing where it hurts, since this tells you what anatomy might be involved. If you're interested in how I do some medical detective work, stay tuned. If you've made it this far in the video, thank you so much for watching. If you have any questions or if you'd like to see a breakdown of another concept in pain, function, or medicine in general, please let me know in the comments. If you want more content like this, hit the like button and subscribe to This Ability Clinic. Thank you. The end.